Good morning to you all. I'm Renee Francoeur with Cabinet Communications and the moderator for today's event. Thank you for joining us for an update on the substance use health emergency in the Territory with Minister of Health and Social Services Tracy-Anne McPhee, the Yukon's Acting Chief Medical Officer of Health, Dr. Catherine Elliott, the Yukon's Chief Coroner, Heather Jones, and Commanding Officer of Yukon RCMP, Chief Superintendent Scott Sheppard. We would also like to thank all of the following individuals for their support regarding this update, some of who are able to join us today via Zoom. Premier Sandy Silver, Minister Jeannie McLean, MLA Jeremy Harper, Mayor Laura Cabot, MP Brendan Hanley, Chief Doris Bill of Kwanlin Dun First Nation, represented today by Councillor Jesse Dawson, Chief Steve Smith of the Champagne and Ajax First Nations, Chief Amanda Lease of Tahan Quachin Council, Chief Simon Mervyn of the First Nation of Nacho Nyack Dun, Chief Linda Dixon of Carcross Tagish First Nation, Grand Chief Peter Johnson of the Council of Yukon First Nations, Deputy Chief Paul Josie of Vuntut-Gwitchin First Nation, and Regional Chief Kluani Adamek of the Assembly of First Nations. Thank you to those who were able to join us today on Zoom, and to Mary Thiessen for providing our ASL interpretation, and to Andre Bossier for providing our French translation. Following the remarks from our speakers, we will go to the media on the phone lines for a round of questions. We'll call you by name, and you will each have 2 questions, and it will be very important for you to let us know who you're directing your question to at this time. Before we begin with Minister McPhee, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to the Minister of Health and Social Services, Tracy-Anne McPhee.
Thank you so much, Renee. Good morning, everyone. Thank you for joining us today on the traditional territory of the Kwanlin Dun First Nation and the Tahan Quachin Council. Thank you very much to the Acting Chief Medical Officer of Health, Dr. Catherine Elliott, to our Chief Coroner, Heather Jones, and to the Chief Superintendent, Scott Sheppard, for joining me virtually today. I appreciate that we wish we could all be together, but in these times with Omicron surging, we must be careful, and fortunately we have some visual platforms like this one, so we can still come together. I would also like to take the opportunity to sincerely thank all of our community partners that have joined us here today and that have supported us in the last number of days as we've discussed this important issue. Today is a truly important occasion, but it is also a somber one. I've gathered everyone here today to speak to a health emergency that has stolen too many lives and left too many others grief-stricken and shattered. I'm here to address substance use, overdoses, and mental health challenges that exist here in our territory. For too many are struggling. Far too many urgently need our help and support. Far too many are dying in our communities and here in Whitehorse. There are no right words for news like this. It is truly heartbreaking. I spoke yesterday with the deputy chief of the Vuntut-Gwitchin, and he said, it really hit me. He said, our hearts are sore, our hearts are aching. We are all completely devastated, and it has been a very difficult start to this year. If you are hurting right now, please know that we are standing with you and that you are not alone. It is time to rally around our communities, our friends, our neighbors, and our family members who need our support. It is also time to come together to take action to address the tragedies that are impacting our communities. Today, I am declaring a substance use health emergency in the Yukon Territory. I make this declaration on behalf of our government. Throughout my tenure as Minister of Justice, we have taken a harm reduction approach to substance use. I now have the opportunity as the Minister of Health and Social Services to bring these two portfolios together and to work in unison. We know this is a public health issue at its core, and we have expanded mental wellness and substance use services, especially in rural communities. It is critical that we speak of this situation as a health crisis and a health emergency as declared today. We have taken major steps with our partners to address the harms associated with illegal drugs in our territory, which are increasingly laced with toxic substances like fentanyl and benzodiazepines. The distribution of naloxone kits, the expansion of drug testing services, and the treatment services available through the referred care clinic have all helped to save lives and reduce harms in our territory. Last year, we opened the first ever supervised consumption site in partnership with Blood Ties and expanded access to a medically prescribed safe supply of opioids to address the opioid crisis. But we know that we must do more. There is simply no other option. We also know that it is not just opioids that are wreaking havoc in our communities. It is also alcohol and other drugs like cocaine and crack. Substance use is killing people and creating mental health crises in each and every community in the Yukon. Last Friday, I called together some community leaders and others in government, as many as I could under very short notice, to discuss substance use and mental wellness. We discussed the need for a bold action to address this emergency in a way that has never been done before in the Yukon. Taking a strong harm reduction approach to drug use, alcohol use, opioid use, overdose deaths, and suicide is a priority for every community, and it is a priority for this government. We are committed to taking action, and today is an important step towards doing more. We know that we cannot do it alone. We need to work together with our community partners, our First Nations partners, and our partners in government at all levels, from municipal to federal. This is going to take a collaborative community approach. The declaration that I'm making today, with the support of those who have joined me and many others who could not join today, is centered on our commitment to action. We are committed to immediate, short, medium, and long-term actions to address this emergency. Action like an aggressive public awareness and education campaign. People need to know that toxic drugs are in our communities and it is not safe to use alone. Action like expanding drug testing and safe supply to communities and increasing availability to those also in Whitehorse. Action like enhancing the supervised consumption site to support those who use inhalants. Action like on the land treatment options that are rooted in cultural healing with our First Nations partners. We recognize immediate action is necessary as well. The licensed practical nurse from the supervised consumption site will be at the Whitehorse Emergency Shelter during the day to promote supervised consumption site and be an extra healthcare worker to provide harm reduction supports and to transport people to the supervised consumption site if they so choose. 2 additional counselors will be on site at the shelter to provide client and staff care response. A physician will be providing drop-in services on site at the shelter next week to provide information about opioid treatment services that are available through the referred care clinic to help people in need. We are working with Blood Ties to extend the outreach van hours to offer drug testing and harm reduction supports at the shelter in the afternoons. There are a number of initiatives underway. We also have commitments from our partners to support and participate in solutions to the challenges that people are facing across the territory. In the coming weeks, in partnership with Yukon First Nations, we will host phase 1 of a mental wellness summit. This summit is part of our commitment to Yukoners, and it will focus efforts to address substance use, the opioid crisis, and suicide prevention. It will hone in on solutions. We need to identify options and solutions. This is something that we have been discussing for several months, including at the Yukon Forum meetings that were held late last year. This issue, this situation, this concern, this emergency is a priority for me and for every leader that I've spoken to. I want Yukoners to know that your government is also working to provide more resources towards mental wellness and substance use services, the supervised consumption site, and our community partners like the RCMP and Blood Ties 4 Directions. There will be more to share about funding in this year's budget. We are developing a new opioid action plan, building on the success of our previous efforts. And we are committed to the Yukon FASD action plan and the paths laid out in Yukon's missing and murdered Indigenous women and girls and Two-Spirit Plus strategy. These are just some of the actions that we are taking, but we know more is needed. We are actively working with our partners to identify more actions and solutions that will come from their communities or governments. We are resolutely committed to supporting Yukoners who are struggling with mental health and addictions. Safety is paramount right now. Check in on your neighbors and your friends. I am once again imploring people to be careful. Get your drugs checked for toxic substances through Blood Ties and the outreach van or at the supervised consumption site. Please do not use alone, and carry Naloxone with you if you are using. Have Naloxone kits nearby, maybe more than one. You can get a kit free at numerous pharmacies, at Blood Ties, or at the Referred Care Clinic, at the Kwanlundun First Nation Health Center and community health centers. There's a full list on yukon.ca, but they are not hard to obtain. This is not the time to shame people or to pass judgment. Our fellow Yukoners deserve the respect and compassion. They urgently need our help and support. This declaration is a commitment to action by our government and a call to action to all Yukoners. We need to address our substance use health emergency and to make our communities more safe and healthy. Thank you very much for listening today, and thank you to all our partners who are here to support us. I can now pass this over to Dr. Elliott.
Thank you, Minister McPhee, and good morning, everyone. Bonjour. I stand here today to support the Government of Yukon's declaration of substance use health emergency in the territory. The loss of life this month is staggering, and it reinforces the need to declare this emergency. Deaths from illicit drug use is a signal. It's the signal of an underlying problem that exists throughout Yukon territory and throughout our society. The underlying problem of substance use, whether licit or illicit, and the toll from alcohol and other substances is profound. I'd like to share a few facts about illicit substance use in Yukon and the health impacts. In 2021, the Yukon saw a record number of 23 deaths from illicit drug use, and there are 3 more deaths pending investigation. Each one of these is a tragic loss of life and affects profoundly throughout the fabric of our society. This marks a 130% increase since 2020, when there were 10 deaths. And it marks an unfortunate 475% increase since 2019, when there were 4 deaths. This drastic rise in opioid-related deaths is deeply concerning. It belies the reality that illicit drug use is not safe. The Yukon's illicit drug supply is contaminated with substances that increase toxicity. This means that all users are at a significantly increased risk of accidental overdose, of injury, of illness, and of death. The scope and devastation of this emergency is only growing. And in order to save lives, we must work together and take action. Today is just a first step, and we know there is more work to do. Much work has been done, and this we can build upon now. I look forward to helping advance the actions and the approach that the Minister has laid out. I'd like to share some information about supports. For now, if you or someone you know may be using street drugs, please know that there are supports and assistance available. If you are using alcohol or cannabis or other drugs, please know supports are available. Here are just a few of the options. There is a supervised consumption site where substances can be consumed safely in Whitehorse. Drug testing, equipment exchange, Naloxone kits, and a variety of mental health supports are available through the Mental Wellness and Substance Use Service and the Blood Ties 4 Directions Center. The Referred Care Clinic provides access to safe supply and opioid replacement therapy and medical care. A volunteer without judgment is available to stay on the line with you 24/7 through the confidential National Overdose Response Service to make sure you are okay while you're using. There are harm reduction workshops for schools and communities, and resources in communities around the territory. Please know that there are people who want to look out for you and care for you. Please don't use alone. In closing, my deepest sympathy goes out to the families and friends, to the communities of every person whose life has ended too soon due to substance use or to mental health challenges. I know this is a very hard time for many people. The days are short, they are getting longer. The pandemic is long, and we are enduring a lot. This is the time to reach out for the supports that we need. In addition, it is now more important for all of us to do our part. Help a friend or family member or neighbor in need by having naloxone available and using it, or giving CPR or calling 911 if this is necessary. Reach out for help and encourage others to do the same. Never use alone. And most importantly, know that people care and they want to help. We all want you to be safe and to get the care you need and live a full life. Thank you. Shonitan, Gunalshish, Masicho. Merci.
Thank you, Dr. Elliott. I will now hand it over to Chief Coroner Heather Jones.
Thank you, and thank you for gathering us together in this way. I want to acknowledge with gratitude the opportunity to be currently serving on the traditional territories of the Kwantlen First Nation and the Ta'am-Kwachan Council. For so many, these lands have been life-giving and a source of both strength and comfort, something we all need, the land and each other. To be here again for this reason is the very last place any of us wants to be. This place is heartbreaking, and yet here we are. And it's important to know exactly where it is that we are, because it is a frightening place. Just to remind you a little bit of background. Over 6 years ago now, we listened with disbelief when we began to hear of the opioid crisis. Most of the news was coming from our neighbors in British Columbia, and the news was frightening. It was in April of 2016 that Yukoners started dying as a result of the illicit use of opioids, or the use of illicit opioids. That was 64 deaths ago. 64 deaths since then. We have also seen in this same time period another 12 deaths due to non-opioid drug overdoses. We have now long since surpassed the grim reality in BC, the one that shocked us so in 2016. This is the Yukon. We know one another. These are not just numbers. We all know who's dying. It's our sons, our daughters, our grandchildren, friends, neighbors, colleagues, on it goes. Somebody's loved one, somebody who loved you. We've all seen and felt the impact these losses have had on our communities. The ever-widening gaps left by the lost hopes and dreams, the lost potential. And I believe we have all experienced the pain as our communities grieve. As 2021 came to a close, Yukon Coroner Service confirmed 23 deaths to illicit drug overdoses. All but one of these were opioid involved. Toxicology is pending for a further 3 cases that are suspected to be drug involved. 3 more cases from 2021 that have yet to be counted. As Dr. Elliott said, this compares to 10 confirmed opioid involved cases in 2020 and 4 in 2019. And today, just 20 days into this new year, we can confirm 4 deaths due to illicit drugs. 3 of these to opioids, all fentanyl. And in the last 5 days alone, we've initiated investigations into the deaths of 3 more young Yukoners. Although we wait toxicological confirmation, there is strong evidence in all 3 cases to believe that illicit drugs will be proven to have contributed to these deaths, very likely opioids. These numbers stagger, the realities of these deaths overwhelm, and all of these deaths were preventable. They were preventable. This is unacceptable in anyone's world, by anyone's definition. The drug supply in the Yukon has been becoming more and more unstable, more toxic, simply deadlier. As has been often mentioned, 2021 saw that a significant number of these deaths had benzodiazepines in combination with opioids. This is deadly. Many deaths have been attributed to cocaine and fentanyl combinations. Alcohol has also been found to be a factor in some of these deaths. And as we know, carfentanil took 2 lives in 2021. We're beginning to see a continuation of this pattern in the 2022 deaths as preliminary information confirms what appears to be a continued possibility of even greater toxicity. It is a time for extreme caution and care. We need to be strong now, strong for each other, strong for those who are grieving, strong together. We must abandon judgment. Not only does this hold down those who are suffering from this illness, it also complicates the grief. And it is simply not true to the human experience that we're all meant to have. We need to create communities of support and compassion in every way, from the individual to the institutions and the systems we work within. We have to ask ourselves, what kind of community do we really want to be? And then take steps to get there. We're Yukoners. We know how to pull together. We know how to get things done. We've seen this often, even in these last few days. I believe Minister McPhee's declaration of a substance youth health emergency in the Yukon today supports us to dig deep, to find what is needed to make the necessary difference, to actively honor the lost lives, to join forces and stop the hurting. Let's use all of the best of ourselves to make sure that no other families are broken by this. No more children losing their parents, no more parents losing their children, no more holes in our community where life and hope used to be. No more preventable deaths. Goodness, geez, Athlin, thank you.
Thank you to the Chief Coroner. I will now hand it over to the Chief Superintendent, Scott Sheppard.
Thank you very much, everyone, and thank you, Minister, for inviting me to participate here today. First and foremost, let me offer my condolences to the communities and the community leaders that are represented here today. As was mentioned on several occasions, many of us have sat here and met on previous occasions, and we're all growing very tired of that. And I know each and every one of us want to try and find a solution to that will lead us out of this ongoing problem. I just made a few notes as some of the comments were being made. Obviously, coming from law enforcement, we tend to put a law enforcement lens on things. I could not agree more, however, that this is a health-related issue. I have said that in the past, and I maintain that so much of these problems are rooted in health. I equally believe the solution can be found through better health measures as well. That being said, I also believe it's a housing issue. It's a mental health problem. It's a poverty issue, and to a lesser extent, in these modern times, it remains a law enforcement issue. Obviously, in Yukon, the RCMP is doing the best it can to align its activities to support the other groups and agencies and NGOs that are doing the best to fight the opioid crisis. Our number one goal is to reduce harm, and I can't stress that enough. It's not about putting bodies in jail. It is reducing harm using the tools that we have at our disposal. We see this day in, day out by our frontline members, whether they are administering Naloxone or whether they are attending another sudden death. They are truly on the front lines of this crisis. It's probably worth noting that even within the professional sphere of policing, this takes a toll on not just the victims and their family, but it takes a toll on the responders as well. Many of the people, especially those most recently who have passed on, are known to us, and our members have either dealt with them on previous occasions, treated them, and have actually developed relationships with them over the years. And it is very, very difficult. All of that being said, enforcement remains a very, very important tool when used in conjunction with all the various health tools that exist. I believe that if we take a measured and balanced approach to this opioid strategy, we will be successful. But I have to caution that if we are insufficient in our enforcement activities, we will create a vacuum and we will leave the illegal drug trade to regulate itself. In so doing, we will see an increase in violence. We will see an increase in deaths. We will probably see a return to shootings. And in all actuality, we will certainly see an increase in the amount of drugs in circulation. That is not to be alarmist. That is simply looking back over the last couple of years since we put some of our crime reduction strategies in place. And I'll remind everyone here that these are our strategies, and the crime reduction team, in fact, is made from internal resources that we've pulled from other units to address this problem as best we can. I am so happy to hear the minister make comment to additional resources to address the opioid strategy. I trust we will put them to very, very good use. I guess my final comments are for the community groups and the NGOs and others that are working with us to combat the opioid problem. Thank you for your support. Thank you for your trust in our activities, and thank you for wanting to help us become better partners. We live in the same communities that you do, and we have a vested interest in ensuring that everyone has an equal opportunity to lead a healthy lifestyle and be happy as a Yukon resident. This crisis transcends salaries and social status and ethnicity. It impacts every one of us, and we don't know when any one of us could be immediately impacted by this. So this is all of our problems, and we need to remove stigma, and we need to have a very open conversation about this. And I'm flattered to even be invited to be part of this discussion. And I rest assured I will do everything in my power, as will our employees in M Division, to support your activities. So Minister, thank you very much for this opportunity.
Thank you. Thank you to all of our speakers. We'll now move on to the question and answer session with media. A reminder to reporters, please remember to mute and unmute yourselves, and please also identify which speaker you would first like to direct your question to. It'll be very helpful for everyone on Zoom. We have no reporters in the room, so we will now go to the phone lines, and we will start with Patrick at Media Q. Hello, Patrick at Media Q. Patrick, I'll circle back to you. We'll now go to Jim at the White Horse Star.
Good morning. Query for Superintendent Sheppard. Could you, sir, describe in a general sense the RCMP's activities or game plan, if you will, to keep some of these dangerous substances from entering the territory without giving away operational secrets, of course, and perhaps gauge the success of the efforts over the last couple of years?
There's a lot to unpack there, and I don't want to spend a lot of time talking about law enforcement, because that really isn't what this forum is about. I will offer that we have been targeting specific agents or specific groups and individuals that are known to be prolific offenders in and around the drug trade, and we have met with some measure of success. I think at the end of the day, if you want to measure just how successful we have been, you only have to look back a couple of years to where, we had shootings and we had gratuitous violence quite literally in the streets. And I think the CRU, the ad hoc CRU, has done quite a good job of containing that. I'm under no illusion. I am not going to make a huge impact right now. I'm just quite happy to keep a lid on things.
Thank you. Jim, do you have a second question?
Yes, I do. Sir, do you feel you have sufficient staffing in the Yukon? And if not, what is your message to the Yukon and federal governments?
We can always use more resources, and I've said this since the first day I arrived here. Additional resources would be helpful, and I have messaged that on previous occasions to the minister and her staff. And as always, we have those discussions as part of our regular meetings and business. And like every other government, they make decisions based on the resources they have and the many pressures they're facing.
Thank you. We will now move to Lori at Yukon News.
Hi, I have a question for Minister McPhee. I'm wondering if she can articulate the three main objectives of the emergency declaration.
Thanks, Lori, and I'll take this opportunity to thank all of the speakers that were here, that are here this morning and have expressed their points of view and concern. I think they're all heartfelt and serious, and will take us a long way to working together. Lori, I think of them as the purposes of the declaration of a substance use health emergency. Firstly, I'd like to say that we were careful to choose the title or the name of this situation because substance use health emergency, I think, identifies the fact that we're talking about illicit drugs, we're talking about alcohol, we're talking about opioid use, we're talking about suicides and overdoses, we're talking about mental wellness issues. A substance use health emergency is aptly named, in my view, to encompass all of the struggles that our communities are currently having. And the purpose of the declaration is to express our commitment and the priority of our government, of all of our partners, and indicate a coordinated response. It is, as I've said, a call to action, a commitment by our government, and a call to action by all Yukoners that we must recognize the concern, the seriousness of this situation, and that we can all help to make it better, to proceed down the road of caring for individuals who have addictions and for recognizing it as a health emergency and a health problem and a health situation that needs to be resolved. Of course, there's an element of justice or of criminal investigations and matters of drug dealing and the illicit drugs, but recognizing it as a health emergency will allow, I hope, our Yukoners to support those who are struggling and to come to solutions.
Thank you. Lori, do you have a second question?
Yes, I'm wondering about, it would be to the minister again, about the move to increase access to treatment, which is usually part and parcel. My understanding is that people are still being turned away at the withdrawal services unit because you do not have the capacity in the beds in order to meet the demand. I'm wondering what moves are going to be made in that regard.
Thanks again, Lori. Access to treatment is absolutely key for us to provide services, a variety of services to individuals who might need them and along their path to recovery. But access to treatment here in the territory has been adversely affected by COVID-19. I would say it's been adversely affected by COVID-19 in every jurisdiction in the country. The requirements for social distancing and congregate living situations have been affected by the measures from public health that we've had to employ. And as a result, there have been some reductions in the availability of those services. Having that come at the same time as a substance use health emergency is obviously not ideal and problematic. We will be working with our partners to increase the opportunities for on the land healing. I think that could be everything from ad hoc situations where individuals might spend time with elders and others to a full-blown treatment services availability in grounded in trauma-informed care and counseling. So I think there's opportunities for us to do that. We've expressed that to every First Nation government. We will continue to do so because clearly some on the land healing opportunities will be led by those governments and the health services that are provided in the communities. And we are supportive of all of those things. And I've sent that message. We will have, I hope through this declaration, the opportunity to work closely with all levels of government, community, First Nations, federal and others to increase the availability of treatment services for Yukoners.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning. Can you hear me?
We can. Thank you, Tim.
All right, thank you. First question is for the minister. Taking a look at the action steps you're taking, a lot of this has been done before and certainly has been done in other jurisdictions, oftentimes without a lot of success. What reason do we have currently to believe that these are going to be any more successful?
Thanks, Tim. I don't necessarily agree that they've all been done before, but a coordinated priority response from this government and from our partners is new. It's not been done before, and it is, I think, by virtue of all of our partners who have appeared today with us, a commitment to work as a team, to work through these opportunities to provide services for Yukoners who are struggling. I think that some of the actions that we have set out have been tried or done before, but enhancing those services, broadening the opportunity for individuals to come in contact with a safe consumption site, for instance, or a safe supply, or an opportunity to go down the road to recovery if they so choose, is absolutely work that we must continue to do and must continue to enhance. In addition to that, we need to work with people where they are. And if they are struggling with addiction, help them to use safely, to make sure that they are safe when they choose to take drugs, and enhance the ability for them to hopefully get on the road to recovery. All of those things are incredibly important. I don't take for granted a single one of the actions that I've noted here today, or a single one that will come from our partners and our community leaders. And we will try all things that have merit, so that we can provide services to Yukoners who are currently struggling and those who wish to get and will achieve recovery.
Thank you. Tim, do you have a second question?
I do, and it would be for Superintendent Sheppard. A lot of people are saying that it is the drug dealers that are the real source of this problem. You said you didn't want to talk about criminal operations, et cetera, but do you have plans to target the drug dealers that are spreading these contaminated drugs?
Well, absolutely. We not only have plans, we've been doing so for years. And I guess I'm going to break that down into a couple different parts. Around the world, we've been doing this for years, and we've seen the results of that. It is part of the solution, but it is not the sole solution. And I don't want to get into philosophies or the politics of how you address an opioid crisis, but as I mentioned earlier, it needs to be measured, and it needs to be balanced, and it needs to be humane, frankly. Many people who find themselves victims to the opioid crisis have fallen victim to it rather unwittingly. It hasn't necessarily been a choice for them. Certainly, we want to reduce opportunities for people to access illicit drugs because they pose a danger. You don't have to be, brilliant to realize if you have fewer illicit drugs, especially those that are contaminated or easily made available by drug dealers, you're going to have fewer deaths. That goes without saying. But to focus on that solely is not only does it not work, it creates other problems unto itself. So what we want to do is we want to be a good partner. We want to, as I said before, keep a lid on things. We want to make it difficult for people to sell drugs, but we really want to make sure that we're supporting the other NGOs and health partners to make sure that people who need help are actually getting it, and that we play a role in reducing stigma, not contributing to it.
Thank you. We'll now move to Hina with the Canadian Press.
Hi, I was wondering if maybe the minister can tell me what is the age group and profile of the people who have been affected by this drug crisis. We haven't heard much about that. And what kind of coordination are you having with the people in BC, where the officials in BC that has been the province that's been so badly affected by this crisis?
Thank you very much, Hina. I will I'll leave the age group to the chief coroner if she's able to give you sort of broad parameters. Of course, here in the territory, we have a small population, so we're always very careful about providing some of that information because we don't want anything to be identifying for individuals or for families. And I wouldn't want to get that wrong, so I'll turn to someone else. But I note that, as the chief superintendent said in his remarks, this crosses all boundaries. It crosses all age groups. It crosses all cultural identification. It crosses all socioeconomic groups here in the territory, and it's affecting everyone in every community for that reason. With respect to the question regarding British Columbia, I can indicate that I have had conversations and meetings with the minister there of mental wellness and addictions, that they have provided us with unfettered access to their officials, to their individuals who are running their programs, and will hopefully be participating in our phase 1 of our mental wellness summit, which will happen in February. And they are extremely supportive of any of the actions that we have taken, and we are learning from their the opportunities they've taken to address the opioid crisis and to support individuals who are struggling with addiction.
Thank you. I'll just open it up to Chief Coroner Heather Jones for the opportunity to respond to the first part of that question.
Great, and thank you for that question and that interest. I will paint a fairly broad brush with this for the reasons that Minister McPhee has indicated. We, especially with our most recent deaths, we want to maintain privacy, etc. However, we are seeing people in their early 20s, just in their 20s, in fact, right up to individuals well into their 70s across the whole scope, as we've said. When we narrow this down to the most vulnerable population, it appears to be men in their early 40s. However, I say that only because that's a statistical analysis. We have to keep in mind that everybody is being affected by this.
Thank you. Hina, do you have a second question?
I do. I was wondering if the minister could explain what a substance use health emergency actually is, and by using it, what powers or authority it gives the government to deal with a problem that they don't have without it.
Thank you, Hina. It doesn't actually provide the government with any authority or powers that it doesn't have otherwise. What it does is express a commitment and by our government and an indication of this as a priority and a coordinated response. As I've said earlier, it is a call to action to our government and a recognition to the public that we understand the concerns, the priority this must take. And it is a call to all Yukoners to help with the responses and with the solutions going forward. It is also, I hope, a recognition of this as a health emergency, not as a criminal situation, although, as we've said earlier, it's one aspect of this. We are indicating a substance use health emergency as a priority for us going forward, as an opportunity to coordinate responses and an opportunity for us to work together with our partners in order to support those who are addicted, those who are using drugs and potentially at risk of losing their lives as a result, and those who want to discover a path to resolution and to recovery.
Thank you. We'll now move to Luke at CKRW.
Hi, this is also a question for Minister McPhee. I'm wondering if there's going to be maybe an increased push to have as many people as possible trained to use Naloxone in the case of an overdose.
Sorry. Yes, Luke, thank you for that question. Absolutely, it will be part of our plan going forward. I spoke with the leaders at Vuntut Gwitchin yesterday, and one of the questions I had for them is, do you have enough naloxone kits in your community? Do you have enough to make them available to everyone who wants one? Do you have have enough training to provide there? And that will be a question we'll ask across the territory. I recognize that in 2018, I believe, we started what was an extremely successful campaign to have naloxone kits in the hands of every Yukoner that is, and then have them trained to use them as they may come across a situation anywhere in the territory where they can be of help. I spoke with some medical professionals even this morning who are carrying naloxone kits in their vehicles. I know many of my colleagues do. I know many of the leaders that you see here supporting us today do, and we will have a concerted effort to make sure that that is renewed, that individuals know how important it is to have one or even two. We know that some of the benzodiazepines that have been laced in drugs we spoke about a week or two ago are not as responsive to one naloxone kit and may require two. So we're trying to send that message as well. There will be a renewed program. It's been very successful in the past, and we need to make sure that we remind people how important this is.
Thank you. Luke, do you have a second question?
I do. This is also for Minister McPhee. Last week, the Carcross-Tagish First Nation declared their own state of emergency in response to drug-related deaths. I'm just wondering what the approach might be to provide more support to communities like Carcross and Tagish, smaller communities, just to assist in situations like this.
Thanks, Luke. I know that Minister Stryker, who is the MLA for Carcross-Tagish First Nation area, has been in touch with Chief Dixon. I see that Chief Dixon is supporting our announcement here today. We have been in touch with them to see what exactly specific issues can be addressed and how we can provide specific support. What I would like to say, and what I said last week when I was asked a similar question, was how pleased and supportive we are that the Carcross-Tagish First Nation took this position, it shows leadership on their part. It shows that they are, as a community, not prepared to live with the concerns and the fallout and the results and the tragedies that occur as a result of illicit drug use that is laced with drugs, and when people take things that they're not aware of. We support them completely. We have provided additional counseling supports. I can indicate as well, similarly with the Vuntut Gwitchin First Nation, we are sending additional supports. We are being led by those communities to ask them what it is that they need for support, and we are working diligently to provide that. Resources are always an issue, of course, financial and otherwise, but I want to express the fact that our commitment going forward and has always been that the financial concerns are secondary to the personnel that we would like to have. Our mental wellness hubs have been successful across the territory, but we struggle to make sure that there are enough mental wellness professionals to provide the services to small communities, even to Whitehorse, but to the smaller communities as well. And I know that First Nations governments and other community governments are struggling as well to have to obtain frontline health workers. So that will be a reality for us going forward. We will do the absolute best we can, and we are actively recruiting mental wellness workers, nurses for communities, frontline healthcare workers that can provide the kinds of supports, including social work, to the communities where it's about making sure there's opportunities for people to know what other services are available.
Thank you. We'll now move to Anna at CBC.
Thank you. This is a question for Minister McPhee. Can you give us an update into the Territory Safe Supply Program that was started last October? I want to get a sense of how many people are using it or accessing it. Thank you.
Thanks, Anna. I don't have those numbers with me. You'll know that the safe supply is structured through the referred care clinic, so individuals can attend there. We have access, the ability to add patients to that clinic's caseload, where they can receive counseling and potentially prescriptions for a safe supply. That's the current situation or a way in which someone can access safe supply in Canada is through a medical practitioner and a prescription. So at this point, we have the ability to expand the patient load at the referred care clinic, but I don't have the specific numbers. We can certainly get back to you on how that has been used. I should say that that is one step in recovery for individuals. And while we want to provide that absolutely to people, it is, there's opportunities, many opportunities, whether it be with Blood Ties or the Safe Consumption Site or at the Whitehorse Emergency Shelter or through the outreach van, where individuals can be encouraged to come to the referred care clinic and hopefully take their path to some safe supply of drugs, almost always opioids and others, and then achieve their own way on a path to recovery.
Thank you. Anna, do you have a second question?
Yeah, I do. So there's a lot of commitments in this substance use declaration, but I'm wondering, this is for Minister McPhee as well, how are you going to be balancing these new asks and these new things that are being put forward during the stage of the pandemic that we're currently in? Thank you.
Thanks, Anna. It's a great question. All the questions are great, but that is a great question, and you've come to the crux of struggle of being leaders in this community right now, and you can see many of them on the screen. I hope you can see them on the screen. I know that we're getting different visuals of the folks who are speaking, but there's lots of support here. We are all, as leaders, struggling, and frankly, as citizens, as members of communities, struggling with the balance of how COVID is affecting our lives. But as a government, we are struggling right now, and as of today, recognizing that we have not one healthcare crisis in the territory or healthcare emergency, but two. And we are recognizing that in this declaration today, that this must be a priority. We will balance the two challenges going forward. Our advice and recommendations from the Chief Medical Officer of Health continue to be strong. We continue to follow the science. We continue to follow that in relation to our public health emergency, to our public health COVID response, and we will continue to do that. With respect to the substance use health emergency we're declaring today, we are recognizing it as a priority. I mentioned some things. The work has already been done to bring these to the cabinet table in consideration of the budget that will come out in 22-23. And we have, through that work, made commitments and recognition that there needs to be some financial commitment to these things as well, so that we can expand the services and make it a priority to help Yukoners.
Thank you. We'll now move to Claudiane, Radio-Canada.
Oui, bonjour en français. Donc, Dr. Elliott, si possible de me dire ou de commenter, la Colombie-Britannique va célébrer le 6e anniversaire de la déclaration d'état d'urgence sur la crise des opioïdes et la situation là-bas a empiré. Comment est-ce que le Yukon fera différemment?
The question is for Dr. Elliott. Can you please say in French What are the measures that are being taken, given that in British Columbia right now they are celebrating the 6th anniversary of this declaration of emergency, and the results are what they are. So how do you see the Yukon being successful in what we're trying to achieve today?
Merci Claudienne pour la question. La déclaration aujourd'hui de urgence du situation des utilisations de substances que le ministère a fait est vraiment une étape très importante pour combattre les maladies et les morts à cause des utilisations des substances au Yukon. La question, c'est comment est-ce qu'on est différent du Colombie-Britannique qui est maintenant dans leur 6e année du état d'urgence de santé publique. Et on a beaucoup de choses qui sont les mêmes du Colombie-Britannique, et on a aussi des choses qui sont différentes. Ici, nous commençons maintenant avec des partenaires dont les policiers, le coroner, le gouvernement, les gouvernements des Premières Nations, les gens qui utilisent les substances, et aussi les gouvernements civiques ici, et beaucoup d'autres partenaires. Et nous pensons, nous avons les leçons du Colombie-Britannique pour apprendre ce qui a marché, ce qui n'a pas marché aussi bien. Et aussi, on connaît que le Colombie-Britannique a beaucoup des régions qui sont plus rurales comme nous, et aussi servent des Premières Nations et beaucoup du secteur de société. Le ministère a nous dit qu'elle a parlé avec le ministère de Santé mentale au Colombie-Britannique, et moi aussi j'ai parlé avec le bureau du chef santé publique à Colombie-Britannique, et nous avons des bonnes relations avec eux, et aussi dans des relations dans les gens qui travaillent directement avec les gens qui utilisent les substances, et aussi dans les recherches. Alors, on a beaucoup de liens. On peut utiliser nos liens, et ils ont donné les supports à nous apprendre ce qu'ils ont appris. Et aussi, maintenant, on commence au Yukon avec les partenaires, avec les gens qui utilisent, et adresser les problèmes uniques ici à Yukon avec toute l'évidence qu'on peut, et l'expérience ici. Merci.
Thank you, Dr. Elliott. If I could just have you repeat the second part of your answer to the second part of that question in English. Thank you.
The second part, we started after the second sentence. Okay. The question spoke to how are we different from British Columbia here in Yukon. And the minister has already said that she has reached out to the Minister of Mental Health and Addictions, I believe it is, in British Columbia, and had offers of support. And I too have reached out to the Provincial Health Officer's Office and received incredible support on this particular file, and in working with people who use substances, decreasing the stigma, decreasing the impact in terms of morbidity, harms, and mortality, and impacts on our communities. British Columbia has been in a state of emergency, public health emergency, for illicit substance use for many years now, and they still have concerns and issues, and they've also made tremendous gains in their work, and we see that they're at this point. British Columbia has fewer per capita deaths, for example, than we do here. We are lucky to have such strong partnerships and to learn. We recognize that British Columbia has some differences and also some similarities, such as a vast rural landscape, working with First Nations and police and many other partners, Coroner, etc. And so this is a time when we can take all of the lessons learned and the evidence that has happened and been generated along the way and start here in Yukon with our partners, with the experience of people who use substances, of communities, of the knowledge and experience of the coroner and the RCMP and within government, and build upon build upon that knowledge to create what is necessary here in Yukon for our communities, and take the lessons learned from these places and around the world and apply them as best as we can here through partnerships. I think the strength of our partnerships is something that is unique, and I think that the coroner spoke to how we are all touched. We are all, 1 degree or perhaps no degree of separation from somebody who has had a challenge with mental health and substance use and has experienced this firsthand. And this is where I think our strength lies, in these relationships. Thank you.
Thank you. Une autre question, Claudienne?
Absolutely. I'm going to ask the question in English because I'd like to hear the First Nation leaders whom we haven't heard from yet. But I would also like the question, please, responded in French for the purpose of radio by Chief Medical Officer here. So how do you think the pandemic has perhaps delayed your ability to tackle the opioid crisis those past 2 years?
Claudienne, who are you directing your question to? Hello, Claudienne, who are you directing your question to?
I want the answer in French by Dr. Elliott, and I also want to hear from the First Nation leaders that are present.
Start with the First Nations.
We'll start with Dr. Elliott. Claudienne, the 4 speakers are taking questions at this time, but I will look into seeing what we can do. 1 second. Dr. Elliott?
OK, merci. Nous avons d'abord, au début de la pandémie, nous étions cognizants qu'il y avait des secteurs de société et aussi des services qui ont besoin de guidance pour pratiquer leur service santé et de l'abri dans une manière qui est sauf pendant une pandémie comme ça. Alors, nous avons travaillé beaucoup avec le shelter ici à Whitehorse et aussi avec les services detox et les services résidentiels pour leur se préparer de fonctionner dans cette pandémie. Et nous continuons ce travail toujours pendant la pandémie. Maintenant, on va, avec cette support, on va regarder s'il y a des autres choses qu'on peut aider avec, même si c'est les services sur la terre, dans la nature pour les gens qui utilisent les substances, même si c'est utilisé dans une manière qui est sauf dans la pandémie. Nous avons aussi regardé et étudié les programmes aux autres endroits au Canada pendant la pandémie et comment ils ont travaillé avec ces difficultés et comment ils ont surpassé ces difficultés. Alors, nous continuons pendant la pandémie. Ce n'est pas toujours facile, mais on continue parce que c'est très important de supporter les gens où ils sont quand ils ont besoin d'aide. Merci.
Thank you, Dr. Elliott.
Minister McPhee.
And Claudienne? Thank you.
Oui, merci.
And Claudienne, we will encourage you to reach out to the First Nation leaders. For this question and answer session, we will target the 4 speakers. Thank you. We'll now move to Laurie at l'Aurore Boréale.
Merci. Ma question est pour Mme McPhee. Vous avez parlé de renouveler le plan d'action sur la crise des opioïdes au territoire, qui est échu depuis décembre 2020. Je me demandais pourquoi l'attente, pourquoi un plan renouvelé n'est pas déjà en place et à quand on peut s'attendre à le voir le nouveau arriver.
So the question is for Minister McPhee. There is a plan, and I'm sorry I missed the name of the plan, for the opioids that should be renewed in 6 months from now. And the question is, why is it not being renewed right away since we are in the middle of this crisis at this point?
Thank you very much. I think the reference is to the Opioid Action Plan, which was put in place at near the end of 2018 for a period of, or 19 for a period of 2 years. What I can indicate and the commitment we've made here, the intention has always been for us to be able to come together in a mental wellness summit and for the purposes of doing all of this work, but finding solutions and renewing the opioid action plan as one of those action items. Unfortunately, as a result of the COVID situation currently, we will break the Mental Wellness Summit into phases, and we will continue with phase 1 in February, which will be a virtual platform. Part of the opioid strategy going forward should come from the work that we do together. This declaration today is, as I've said, a commitment, a priority making commitment by our government and by the other governments and community leaders across the territory to do this work together. So a renewed opioid action plan, opioid strategy should come from the work that we do together. It's not something our government should decree or should put together alone. We will work with our partners to make sure that the opioid action plan or a new strategy going forward encompasses all the things we've talked about today and more when there are resolutions or solutions that come from our partners.
Thank you. Une autre question, Laurie?
Oui, merci. Ma question est encore pour Madame Elliott. En fait, pour Madame Elliott cette fois-ci. J'avais parlé avec Dr André Corriveau à l'automne. Il me disait qu'il fallait aussi agir avant que les dépendances se créent. Qu'est-ce qui va être mis en place pour diminuer le nombre de personnes qui entrent dans cet engrenage de dépendance?
So the question is for Dr. Elliott. Dr. Corriveau had discussed previously that it's really important to really get to the people before they fall into addictions. What is going to be undertaken at this point to make sure that we have a plan for prevention of the creation of these addictions?
Merci pour la question. Oui, nous sommes vraiment cognizantes et dédiqués au programme qui aide aux gens d'avoir des périodes de l'enfance qui est vraiment sauf et qui est plein d'expériences de santé et pas du trauma. Et ça, c'est les choses qui sont très importantes pour éviter que les gens entrent utilisant les substances et puis devenir utiliser les substances dans une manière qui est problématique. Nous supportons le gouvernement avec leur programme d'éducation pour les très jeunes, éducation aux écoles, pour rendre les gens plus de savoir pour leur vie, mais aussi aux éducation, aux santé, éducation des substances et de la vie vraiment santé. Il y a aussi des autres choses qui deviennent les vies des familles plus sanctifiants, comme les programmes de l'abri, de nourriture et des programmes culturels. Et c'est toutes ces choses ensemble qui deviennent, qui supportent les familles où ils sont avec les difficultés qu'on a en être parent ou bien avoir les enfants. Et c'est très important d'avoir ces programmes et aussi d'adresser les causes du trauma. Et toutes ces choses ensemble sont importantes, d'éviter des gens d'avoir la douleur qui est souvent la cause d'avoir utilisé les substances et puis aller dans les substances problématiques et puis les mauvais impacts de ça. Alors, c'est vraiment une approche qui devra être de naissance à mourir. C'est toute la vie qui est partie de cette approche et on travaille ensemble d'adresser ces programmes dans le long terme aussi. Merci.
Dr. Elliott, I could get you to repeat a brief summary of your answer en anglais.
I wonder if the minister could also contribute in English, if she would like. Yeah. I'll repeat briefly in English, and perhaps Minister McPhee, if you'd like to speak in English about this as well. The question was about the importance of preventing people from entering into problematic substance use, and this is an extremely important part when we look over the long term. You know, it may take some generations before we arrive in a place where problematic substance use is truly a thing of the past. And I think if we look at the reasons that people enter into problematic substance use, we look at the challenges of families throughout their life course, things like education, the need for education, the need for shelter, food, and supports when trauma or challenges occur. All of these things contribute to the pain that can lead people into substance use. And we support the government in addressing these underlying causes. And I see this as one of the key cornerstones of working on the challenges of substance use and problematic substance use in the future. In terms of the programming, I'd like to turn it to the minister in terms of the work that's happening within government, and we certainly support work in early childhood education and the education system as well as in communities in these regards.
Thank you very much, Dr. Elliott, for that question. It's, of course, in line with what I would have said. Of course, we need to have the availability of trauma-informed counseling so that individuals who are struggling with issues in their lives before they turn into mental wellness issues or mental health issues, or as they are, can access trauma-informed counseling. We know that there is very difficult times in the past year and a half with respect to residential school recoveries and reconciliation with respect to our First Nations citizens, and making sure that our work as a government, as a community, builds in reconciliation so that individuals can have access to those kinds of services. We know that I heard Minister McLean speak this morning about a renewed education system, recognition of the opportunities that must be and should be available for individuals, and early learning childcare being a priority as well. When we improve these things coming up through the system, then citizens and individuals who come there may have less trauma, less concern, less turning to alcohol and drugs to deal with their pain, as Dr. Elliott has said. But I think a lot of what I've talked about today is about the response to individuals who are already addicted, and our caring and compassionate approach that we must take to this health emergency and health crisis. All of the efforts at prevention are equally important, and our government has worked extremely hard in the past almost 6 years to focus on making Yukoners' lives better. And that in many aspects and every aspects of the work that we have done is for the purpose of doing exactly that, which is making Yukoners' lives better so they can deal with life's struggles and challenges in a way that is healthy for them. There is too many avenues where that has been improved for the lives of Yukoners to speak about them today, but know that that has been our goal, that has been our purpose, and that in every decision, we turn to the question, will this improve the lives of Yukoners? Will this affect Yukoners in a positive way? And that's the way that we've done our work and will continue to do it.
Thank you. We'll now move to Sarah at APTN.
Can you hear me okay?
We can. You're a little faint, Sarah.
That's okay?
We can hear you.
Okay, great. I'm just wondering, I just have a question for Minister McPhee. I guess I'm just wondering, why declare a public health emergency now? A few months ago, the residents of Mayo were asking for a state of emergency because of the opioid deaths happening in that community, but they weren't granted one. So what's different now?
Thanks, Sarah, for that question. There discussions with the community of Mayo and their questions about a public health emergency, and I'm going to call it the substance use health emergency because that's, as I've noted earlier, been carefully chosen to be the description of what's happening here. The community of Mayo was responded to. We spoke with the chief and with the mayor and with individuals who are concerned and wrote to us. We continue to work with them going forward. They have some specific asks about social worker and nursing staff in their community, and those are being responded to as well. This public health, I should say substance use health emergency, is as a result of a number of factors. At the time, we were speaking with First Nations leaders at the Yukon Forum, and we took the idea of a health emergency to that discussion and had great feedback. We also discussed at that time the mental wellness and substance use summit, which, as I've described, has had to be changed from in-person summit, which we really hope to gather individuals and talk about this really important issue in person. It is so important for individuals to join together and to discuss these issues and to learn from individuals with lived experience and other leaders who've had some success. We are not able to do that right now. The discussion with Mayo was that we had hoped to have their input also with respect to this, and I have spoken with Chief Mervyn, and he was on the call that I spoke about on Friday. And it is time, as a result of a number of factors, all of which I've described all morning here, to come together to gather the leadership of the territory. We support communities like Mayo and Carcross Tagish and the Old Crow and the Vuntut Gwitchin people in their individual situations, and we are working with them. And it is time for us to gather together the leaders that are here and the others that were not able to be here today, and for us to speak as a wide Yukon community led by government. I appreciate that. I'm happy that we could do so. But it is a territory-wide situation, and it is time, and we have declared a substance use health emergency, which needs to be responded to.
Thank you. Sarah, do you have another question?
No, that's everything for me. Thank you.
Thank you, Sarah. We'll now move to Brianna at Canadian Press. Trying you one more time. Brianna at Canadian Press. Okay, and I'll circle back one more time. Patrick at Media Q. Hello, Patrick? Hearing nothing, that concludes our event for today. Thank you to Minister McPhee, Dr. Elliott, the Chief Coroner, Heather Jones, and the Chief Superintendent, Scott Sheppard. Thank you to all the leaders who joined us by Zoom and to those who could not join but send their support. And thank you to all the media who joined us as well. Special thank you to Charles and Etienne, our sound technicians, for helping us get this underway. There's always some challenges to get everybody involved remotely on short notice, and it's greatly appreciated and important, so thank you. Take care of yourselves, everyone, and stay safe.